Hi, my name is Yasel. I'm a first year respiratory student, and today I'll be giving an explanation on the indications for mechanical ventilation. So, to start off with, what is mechanical ventilation? Mechanical ventilation is a form of positive pressure ventilation, which is used to ventilate a patient and take over their work of breathing, which is the main purpose. If a patient is going to be mechanically ventilated, they need to be monitored very closely since normally we don't breathe using positive pressure ventilation. We actually breathe with negative pressure ventilation. So what this does for the patients is that when they're on the ventilator, their thoraco-abdominal pump mechanism is actually decreased during inhalation and increased during exhalation. And for us, it's actually the opposite. And they also need to be monitored very closely for other side effects that they could possibly suffer. So to start off with, one of the indicators for mechanical ventilation would be that the patient is unable to protect their airway. So this could be due to a result of trauma, any neurological dysfunction, anesthesia, um, or any drug overdose where our CNS system is depressed. Um, the patient could also be apneic, meaning they're not able to spontaneously breathe on their own. Um, Other cases where the patient's CNS system, their central nervous system, is depressed would be if they experienced any head injury, they had an alcohol overdose, or they have a neuromuscular problem, like it could be like GBS. Another indicator for mechanical ventilation would be impending acute ventilatory failure, meaning that the patient is unable to ventilate properly due to being hypercapnic. So, what this means is that they have increased CO2 levels. So, what you could do in order to confirm this diagnosis is perform an ABG, and in the ABG, um, it would present as acute respiratory acidosis. And you could also confirm the diagnosis by doing a patient assessment, and some signs that you would see are respiratory muscles fatigue. You would see the patient using their accessory muscles to breathe. So they're having a lot of trouble breathing. So the patient is also probably very tired since they have respiratory fatigue. Um, Another indicator for mechanical ventilation is prophylactic measures, meaning that you want to prevent any future diseases that the patient could be at risk for, such as atelectasis, or even prevent a COPD exacerbation. So many COPD patients, they will be um, called with the term frequent flyer. So many times they go back to the hospital very frequently because they are at risk for much more diseases, since COPD predisposes them to a higher chance of acquiring other diseases. Then another indicator for mechanical ventilation is a patient being hypoxemic, which means that there's an abnormal deficiency of oxygen in the arterial blood. So what you could do to confirm that the patient is hypoxemic is perform an ABG, and then if in the ABG their PO2 is less than 80 millimeters of mercury, then they're hypoxemic. But another easier way would also be to get their SpO2 by using a pulse oximeter. So if the pulse ox reading is less than 95%, then this would indicate hypoxemia. Um, this is really important since the patient is not having enough oxygen. in their body to meet their metabolic demands. So with mechanical ventilation, you would actually be able to treat the hypoxemia.